special for that. Okay, thank you very much. And the time is yours, Faye.
Thank you, Vinci, for the introduction. And it's so good to see you all again. Good evening. I think you guys are the same batch from last week. I can recognize some of your faces. You look very familiar for some of you. So very happy to be here again. And today I will talk to you about pharmacies-led immunization services or vaccination services in Australia. But because I know that in Australia, we have a different legislation, different law compared to in Indonesia, I'm going to give you a snapshot about what is happening in Australia, but then I will focus onto some of the clinical aspects and practical and pharmacy practice aspect of immunization services, so that will be more relevant to you. So as per last week, I declared that I work at the Curtin Medical School and I hold the national presidency position at the Pharmaceutical Society of Australia. I'm a community pharmacist and pharmacy owner in Western Australia. So today I'll give an overview of the progress in which how pharmacies immunization services started in Australia. I will talk about the process of pharmacists providing immunization services. I'll talk about some of the guidelines that are relevant in Australia to guide the practice of pharmacists in Australia and how pharmacists go through a consenting and screening process with the patient. And also hand hygiene and infection control. How do pharmacists manage anaphylaxis and how do they go through training? How do we manage cold chain and what is cold chain and storage of vaccines and some other considerations about vaccinations. So to give you a bit of background, pharmacists providing vaccinations and injections in the pharmacy is not new. It actually started many years ago and is well established in other parts of the world, like in the USA, in the UK, in Egypt, in Portugal, in New Zealand, in Saudi Arabia, in Canada, in some parts of India as well. And the main reason for why vaccination came into pharmacy was because of the access. It's because of the accessibility of pharmacy. I know in Indonesia, it's quite similar. Pharmacies are very easily accessible by the community. And therefore, if you have the service running in the pharmacy, it's very easily accessible by the local people. So then you can increase vaccination rates when you increase access to vaccines. And it all started in Australia in December 2013, when the Pharmacy Board of Australia actually put out a statement to say that vaccination was within the scope of practice of a pharmacist, provided that they're appropriately trained and that standards were in place. And then you can see very quickly, immediately in 2014, in Queensland, which is one of the states in Australia, the Queensland state started doing a pharmacy pilot project called the QPIP, and that started early in 2014. And immediately that was following just another pilot trial in Terry White Chemist in 2013, where the pharmacist brought in nurse immunizer into the pharmacy. But in 2014 in Queensland, that was the first time when pharmacists actually provided that vaccination. And then it very quickly, you can see here, the pilot, which is just a trial, involved initially only 157 pharmacists, but now the majority of pharmacists, a big proportion of pharmacists in Australia are vaccinated. It started with flu vaccinations only. And at that time, there were more than 11,000 adults vaccinated. And you can see here from the survey, over 93% of the people who received the vaccines were happy to receive the vaccinations from the pharmacy. And then you can see here in late December 2014, in Western Australia, the legislation was amended as well. And then subsequent to that, that's how it started. Every other state then basically came on board as well. So right now in Western Australia, everything that we do must comply with the Western Australian Health Department's Structured Administration and Supply Arrangement, which is basically that's the law to tell us what pharmacists can and can't do when it comes to vaccination. And at the moment in Western Australia, appropriately trained pharmacists can actually provide vaccinations, including influenza vaccines, measles, mumps, rubella, diphtheria, tetanus, and pertussis, which is whooping cough, meningococcal ACWI, and also all of the ranges of the COVID-19 vaccines. Now, these vaccinations can be provided by a pharmacist either inside of a pharmacy or outside of the four walls of a pharmacy. But there are very specific ages for very specific vaccines. So, for example, for some of the COVID-19 vaccines, it's only approved for us to give to people 5 years old and above. But for some of the vaccines, it's only approved for 16 years and 18 years. Because this is a very fast-moving policy area, it literally changes every few months. I didn't want to put down the ages here because otherwise it might not be current anymore later on. But this is just to show you that about the scope and the extent of pharmacists providing vaccinations. And a good fact for you is that right now, currently, in any given day, pharmacists are providing the majority of COVID-19 vaccines in Australia. So that's how much vaccines pharmacists have now been relied upon when it comes to giving vaccinations. So I want to now talk you through some of the steps. So someone can either make an appointment or they can walk into the pharmacy asking to be vaccinated. And then what will happen is that the pharmacy staff will advise the patient the cost, what is involved, and how long it would take. Then the pharmacist would advise the patient and do pre-screening. So pre-screening means the pharmacist will ask the patient a series of questions to find out if the vaccine was suitable for them to receive on the day. So during that process, we will ask patient about, their age and their medical history. What sort of medical conditions do they have? Are they on any other medications? Are they taking any other over-the-counter medications that may interact with the vaccine? When was the last time they had another vaccinations, just to make sure there are no interactions? Did they get any severe reactions or adverse reactions, anaphylactic reactions or other reactions, adverse effects to vaccines in the past? So all of these sort of questions to find out if it was suitable for the patient to receive the vaccine today. So if the patient is deemed to be not suitable, so if once the pharmacists have done the pre-screening and if the pharmacists find out that the patient is not suitable to be receiving the vaccine in the pharmacy today, the pharmacist will make a referral so the patient can go and see their GP. If the patient is deemed to be suitable, then the pharmacist will collect patient details. We will enter the information onto an online system. We will tell the patient what the vaccination process involves, what sort of vaccinations or injections they'll be receiving today, and where will we be giving it to them, including telling them it will be the upper deltoid on the left or the right arm. We will tell them what to expect, what sort of adverse reactions can they expect to receive, and we will also talk to them about the importance of waiting for 15 minutes after vaccination. Then the patient will read and sign a consent form. So a consent form means that the patient has to sign, give a signature to say that they are actually giving consent and they agree to receive the vaccine in the pharmacy that day. And then the patient will be ushered into a private consultation room, but part of this can also be done in the private consultation room. And then what happens is the immunizer pharmacist will see the patient in the private consult room. They will confirm that the patient understands what is involved and that they have given consent. And then the pharmacist will wash their hands. Very important. Hand hygiene is very important. And I'll talk about hand hygiene a bit later. And the pharmacist will check the vaccine expiry date and the storage. And for all of the COVID-19 vaccines at the moment, they all come in multi-dose vials, which means in every vial, there are multiple doses, more than one dose. There are a few doses in the one vial. So often pharmacists at the start of the day will have to draw out the required volume into individual syringes and needles, and then store them according to their storage conditions, and then label them accordingly as well. So the pharmacist actually needs to check all the time that they're giving the right vaccine and that the vaccine is still in date, still not expired, and it is stored correctly. And then, of course, the pharmacist then administer the vaccine into the person's arm. Most of the vaccinations are intramuscular, means it goes into the muscle. Some can be given as a subcutaneous injection, which means just under the tissue in the subcutaneous tissue, under the skin in the subcutaneous tissue. Once the pharmacist have given the vaccine, you can see that the pharmacist must immediately dispose of the sharps, because it is considered as a hazardous waste, because you don't want any needle stick injury and any risk of transmitting bloodborne viruses. So we have to chuck them, we have to discard them or throw them away into what we call a yellow bin or a yellow sharps container. And then immediately the pharmacist needs to do hand hygiene again. And then what happens after, the pharmacist would give them a vaccine aftercare card or any similar information provided by the pharmacy. The patient has to stay in the pharmacy for 15 minutes. During that time, the patient will be monitored in case they are showing any signs of adverse drug reactions. If there are no adverse drug reactions after 15 minutes, the patient will leave the pharmacy. The patient starts to show any minor or common adverse drug reactions during that 15 minutes, the pharmacist will just provide some support. So sometimes if they are in pain, they can give them an ice pack and so on. If they develop a severe allergic anaphylactic reaction, this is life-threatening, which is why we have to commence emergency anaphylaxis management immediately. So we have to follow a very strict anaphylaxis management protocol. And every pharmacy now, if you provide vaccination services in your pharmacy, you must have what we call a defibrillator. So it's a machine that you can use it as a defibrillator to reactivate the person's heart if the heart stops. But you also must legally have on hand adrenaline injections. So you all know what adrenaline injections are. So that is for if someone has anaphylactic reaction, the adrenaline injections is there to save their lives, to basically reverse that anaphylactic reaction and save their lives. So we have to manage that, call the ambulance immediately, and record this in the patient's profile as well. Also, at the same time, the pharmacist needs to provide and complete documentation and then let the doctor know. But at this stage, we actually have what we call an Australian Immunisation Register, which is an online platform that is real-time, that all immunisers must actually upload that information onto the Australian Immunisation Register. Records must be kept the same time. So that was just to tell you about the process. You can see how the reflection I hope you will get is that often when we teach pharmacy students, so right now we teach final year pharmacy students how to vaccinate. And often students will tell me, oh, you know, I'm nervous about giving injections and so on. But really, giving injection is only one of the so many steps in the whole vaccination service. And I can tell you the most complicated and the most complex part of this service is not injecting the needle into the person's arm. It's actually the screening and the questioning process to make sure that the vaccine is suitable for that person. So it's not just about sticking the needle into someone's arm. You can see now there are a lot of processes involved. So this slide here is to show you that in Australia, this is produced by by the Pharmaceutical Society of Australia. It's called the Practice Guidelines for Pharmacists Providing Immunisation Services. So it's a guideline to provide guidance to pharmacists on what to do when we provide vaccination services. And I will encourage you to have a look in your own time. And just like last week, I will send the slides to Vinci, your lecturer, and Vinci will share that with you all. And I've given you the link here. You can just copy and paste this link and you can get a full copy of this guideline. It will be really good information for you. So patient consent. So I talked about patient consent earlier. So patient consent basically just means that you need them to give you the agreement that they are agreeing to getting the vaccine from your pharmacy, because we can never force any treatments on anybody. And because of that, you must make sure that you obtain patient consent before you give them the vaccinations. And what do we mean by consent? So there are 3 elements of a valid consent. So valid consent means that, number 1, it must be provided voluntarily. And this means that they're not forced to provide the consent. They're doing it voluntarily, willingly. The second is that it must be provided by a person with adequate legal and intellectual capacity. It means that that person actually is able to provide that consent, that they actually legally, they are able to have adequate legal and intellectual capacity to do that. Also, the patient must be provided with detailed information about the procedure, the benefits, any potential or actual risk involved, and also with the options of alternatives if required. So those 3 elements must be met for this to be considered as a valid consent. So it's not just about, do you agree? Yes, you have to consider all of this. So basically consider if all these 3 elements of a valid consent are present. So also the details of the vaccine must be recorded and documented. The details of the procedure of the vaccination must also be recorded and documented. So this is a slide to talk to you about patient screening. So patient screening means you have to talk to the patient, screen the patient before giving vaccination to find out if the vaccine is safe for the person and appropriate for the person to have it that day. So we go through this process here. We have to consider HALO. So HALO, that stands for considering the patient's health, their age, their lifestyle, their occupation. And you want to consider their occupation because just in case if they are of a particular occupation, let's say they're a school teacher, they've come in for one type of vaccine, but you know that they're also at risk of other vaccine preventable diseases, then you have to talk to them about those things and encourage them to get vaccinated. Also, another example is lifestyle. If they tell you that they're going traveling, you should be asking them about, you're traveling, where are you traveling to? Because certain parts of the world, there are increased risk of certain diseases and conditions, and therefore we should always encourage them to receive vaccines if required, the particular type of vaccines if required. Also, the health status, consider the health status and the history, what medical conditions they have, what medications are they currently taking, including prescription, over-the-counter, and herbal or complementary medicines. We should ask them about their allergies, adverse reactions, and prior reactions to vaccinations. I have to stress that it's so important to assess the patient thoroughly, and that's what we mean by screening, to make sure that the vaccine is suitable. I talked about hand hygiene earlier, and I mentioned that hand hygiene is very important. Now, I know we all have washed our hands before. You all know how to wash your hands, but I can tell you actually before COVID, whenever we go and wash our hands, we probably turn on the tap, we just wash for 3 seconds, and then we run away, isn't it? We just wash it for 3 seconds, but that's not enough. If you look at this guideline here from the World Health Organization, a proper hand washing session should be 20 to 30 seconds. And I think because of COVID, we've all taught about how to wash our hands again and how to sanitize our hands with alcohol hand sanitizers. But I think we should always think about, if you wash your hands too fast next time, we are all guilty of doing that. But if you wash your hands too fast next time, remind yourself 20 to 30 seconds is what you need. Every single step. So all the way from, at the start, you either use soap or you use an alcohol hand rub. You first distribute that evenly. Then you have to clean between your palms. Then you have to clean on top and then the other way. and then with your fingers interlocking, and you can't forget your thumb, both thumbs, and your fingernails as well. So you'll be washing your fingernails. And then you have to make sure, if you're using alcohol rub, you have to just make sure that your hands are dried completely. It has evaporated completely before you touch anything. So this is an example to show you how a vaccination clinic is set up. So you can see here in every vaccination clinic, we're we focus a lot on hand hygiene. And there must be, either alcohol hand rub, or over the right hand side, you can see how to hand wash using soap and water. And I want to talk about infection control as well, and needle stick injury. Now, we know that needles are dangerous, and we know that needles can cause injury, but also if a needle has gone into someone's body, and if you don't know if that person has any bloodborne viruses or bloodborne diseases, such as HIV or AIDS, or hepatitis B, hepatitis C, these are examples of diseases that can be transmitted from a needle stick injury. So we take needle stick injury protocol very seriously. So this is what we call infection control and needle stick injury. So in every clinical setting, including in the classroom when we teach pharmacy students here at Curtin University, or including every pharmacist in every clinic, we must have an infection control protocol. So in the infection control protocol, we talk about things like, if you have long hair, you have to tie your hair back up. And I actually tie my hair back up today for you all. I normally have my hair down, but because today it's about vaccination, so I've decided to tie my hair up. If you're in a clinic environment, you must have all your hair up, because you don't want to have hair around your patients when you're vaccinating someone. You must wear closed-in shoes, so not open toes. It must be closed in to protect your feet, because if you drop the needle accidentally, it's not going to injure yourself. And also, right now, we do not recommend wearing gloves when vaccinating, because if you practice good hand hygiene, there is no need to wear gloves. However, if you have a cut or a wound on your hand, and you feel that there is a risk of transmitting and exposing yourself, and from an infection control perspective, it's a risk for you and the patient, then yes, you can wear gloves. Then you should be putting on, Band-Aids and wound care dressings, and then put on a pair of gloves to protect yourself and the patient you're vaccinating against. And part of this infection control and needle stick injury protocol is also, you must have a yellow bin. So you can see here, for example, we'll show you some examples of yellow bins. In Indonesia, it might not be yellow, I'm not sure, but basically it's special bins specifically for sharps. So sharps means needles and syringes and so on. So it must be into a specific thing. And you must have a protocol to talk about how the needles and sharps are going to be disposed. How do you prevent a needle stick injury? And how do you manage a needle stick injury when that happens? I now want to talk about adverse reactions after vaccinations. So we all know that all medicines can cause side effects. And vaccines are actually medicines. Vaccines are considered as medicine. So vaccines can cause reactions. Vaccines can cause adverse reactions. The most common adverse reactions for all vaccinations are local injection site reaction. Usually a bit of pain, tenderness, it might feel a bit warm, there might be a little bit of swelling and pain and redness on the site, but usually those will go away within 24 to 48 hours. If patient finds that has happened, there is local swelling, pain, and inflammation and redness or warmth, then what they could do is to use ice packs. So use an ice bag, wrap that in the towel, 20 minutes on, 20 minutes off. That will help take down some of the pain. If there are no drug interactions, they can take some simple analgesics like paracetamol or ibuprofen as well, if they have that reaction. But we do not recommend people to take paracetamol or ibuprofen prophylactically before vaccination. So what that means is we do not recommend people to take paracetamol and ibuprofen just in case before a vaccination, because if they're fine, they do not need the medications. But if they do have any sort of reactions and they need that simple analgesic, then yes, they could take them. So it's very important to advise patients how to manage those reactions. And sometimes what can happen is what we call a vasovagal reaction or fainting. Some people can faint when they think or look at blood or think about needles. When that happens, basically what that means is that blood is being drawn down from the brain back down into the core, into their heart, to keep themselves, the heart pumping. And when you have blood drawing away from your brain, it causes fainting. So to manage this, the best thing to do is to get the patient to lie down on the floor, and you raise their feet up and have their head lying on the lower part, because that way gravity will mean that blood from the bottom part of your body will be encouraged to flow back into the brain, so that immediately the patient will regain some level of consciousness. But the last dot point here, you can see, sometimes some people can develop rare but life-threatening, people can die from it, what we call anaphylaxis or anaphylactic reactions to vaccines. Basically, what that means is when that happens, people can die from it. And you have to use adrenaline immediately to save the person's life. And that is why I mentioned earlier, every pharmacy must have an anaphylaxis response protocol. So pharmacists would know how to manage the situation if that happens. And also now pharmacies providing vaccinations will also have a defibrillator, which is part of your physical first aid training that you would have done if you haven't done a first aid training. And the defibrillator is there to help to restart someone's heart if their heart stops pumping. So I cannot emphasize enough that adrenaline must be used immediately to save lives. Anaphylaxis can be considered in two circumstances. So these are the two signs you will be able to tell if someone is experiencing anaphylactic reactions. Number one, any acute onset illness with typical skin features like urticaria, rash on the skin, or erythema, flushing, which means redness, and or angioedema, swelling of the tissues, plus involvement of respiratory, so breathing, or cardiovascular, their heart, or persistent severe gastrointestinal symptoms. Or it could be any acute onset of hypotension, so low blood pressure, or bronchospasm, which means the spasm or and sudden sort of spasm of their breathing tract, their bronchus, or their upper airway obstruction, where anaphylaxis is considered possible. Now, in those circumstances, those are typical signs and symptoms to tell you that that person may be experiencing anaphylaxis. And we always tell pharmacists, if in doubt, if you're not sure if the patient is having anaphylactic reactions, you always give them adrenaline. You don't wait. You don't take the risk. You would always give adrenaline injection if you suspect, even if you're not 100% confirmed, if you suspect, you should give them adrenaline. So this slide here is the example to show you that every pharmacy must have an anaphylaxis response kit. So this is extracted from the Australian Immunisation Handbook. And once again, I've given you the link here, students. You can go and have a look, have a read in your own time. And it basically tells you what the recommendations of the Australian Immunisation Handbook is in relation to the anaphylaxis response kit. You can see in here that it says you must have at least 3 ampoules of adrenaline 1 in 1,000. You must always check the expiry dates to make sure that it is in date, because chances are hopefully you're not going to need them. So you want to check them regularly to make sure that they're still in date. And you also want to make sure that you have at least 3 1 ml syringes and 25 millimeter needles for intramuscular injections. You want to have some cotton wool swabs, want to have a notepad and pen, make notes, because what you want to do, you have to document and record down the time and the date and the symptoms for everything that is happening. So when the ambulance and the paramedics arrive, you can hand over the case to them and you would have all the details. You should also have a laminated copy of the doses of intramuscular injection for anaphylaxis, which is a protocol in your bag, because depending on the weight of the patient, they're going to require different doses of adrenaline. So you want to be able to very quickly work that out and be able to draw up the required amount of adrenaline from the ampule. And you also need a laminated copy of the recognition and treatment of anaphylaxis protocol to remind you what to do in those circumstances. This is to show you, this is an example, a photo that I took where in the school where we actually train vaccinations with students. This is an example of how the clinic should be set up. You can see on top there, there is the physical first aid box. And then on the right-hand side, you can see on the wall, the ASCARE action plan for anaphylaxis. On the bottom of that, there is a CPR chart as well. Now, I want to talk about cold chain and the storage of vaccines. Now, the vast majority of vaccines must be stored refrigerated between 2 to 8 degrees Celsius. And we always say strive for 5. 5 means 5 degrees Celsius. Even though the recommended range is 2 to 8 degrees Celsius, as much as possible, you want to be in the middle at 5 degrees Celsius. But I also want to take this opportunity to point out that some COVID-19 vaccines now require different storage conditions. You may know that some of them have to be deep frozen in minus 30 degrees when they're in storage. But when you once thaw, meaning once you make them turn into a liquid, they only have a very short shelf life. So some of them would only have, say, 30 days of shelf life, depending on which vaccine it is. And I haven't given you the specifics here because there are many different brands available, and I'm not really sure what brands of COVID-19 vaccines are available in Indonesia at the moment. And the storage requirements can change as we navigate through this COVID world that we live in now. So instead of memorizing them, you should always double check the manufacturer's storage conditions and requirements. So cold chain basically means from start to finish, from the point of manufacturing the vaccine all the way into when the vaccine is administered or injected into the patient. So cold chain must be applied from the start to the finish, meaning that at all times, the vaccine must be stored accordingly based on the manufacturer's recommendation. So this includes when it's made, when it's been manufactured, when it's been transported by delivery companies, when it was delivered, when it's unpacked in the pharmacy, when it's put in the pharmacy fridge, when it's taken out, when it's given to the patient. From start to finish, you must meet this cold chain storage requirement. And there must be a system in place to monitor for cold chain and cold chain breach. So cold chain breach means when at any point in time during that cold chain that something has gone wrong with the storage. The temperature might have gone outside of what is recommended. And if there was a breach, the clinicians need to you should really consider based on manufacturer's advice and the type of vaccines that you're dealing with, whether it is still safe to be used. And also there is vaccine fridge monitoring as well that we take very seriously. So the fridge temperature must be monitored at least twice a day, in the morning and at night, and documented and charted to make sure that the temperature of the fridge doesn't fluctuate too much. It's quite stable, and it stays between 2 to 8 degrees Celsius. If you can keep it around 5 degrees Celsius, that would be perfect. And also in Australia, all vaccines are considered as medicines and they must be stored in a vaccine fridge. In a pharmacy, you cannot put vaccines in your normal lunch fridge. And in the vaccine fridge, you can't have your lunch there, no drinks, no food. There's specific fridge, what we call them as vaccine fridge, specifically for vaccines and medicines as well. So some medicines such as thyroxine, which you would know, or insulin, for example, which those medicines will require refrigeration. You can put them next to the vaccines, but they must be in a separate fridge and not in your regular food fridge. So that's the end of my presentation. So I'll pause there and take questions from you all.
Thank you very much, Faye. What an interesting presentation about pharmacist-led immunization. So students, you all still remember Dr. Tin Fei Sim is also my supervisor. She's also senior lecturer at Curtin University. She's also coordinator of international engagement. But besides of that, she's also the national president of the Pharmaceutical Society of Australia. So there is like the president of the Ikatan Apoteker Indonesia. It's the same like that. Okay. Besides of that, she's also a registered and a practicing pharmacist in Australia, a community pharmacy owner, and also a pharmacist immunizer. Is that right, Faye? So community pharmacy immunizer is the pharmacist that is approved to administer vaccines in community pharmacies. So apoteker yang bisa memberikan vaksinasi di apotek, ya. That's the pharmacist immunizer. Thank you very much for the presentation, Faye. It's a pleasure. So question session time. So if you all would like to ask Dr. Tin Fei Sim any questions about the lecture today about the pharmacists, how pharmacists administer vaccination in Australia, any clarifications that you would like to ask Dr. Tin Fei Sim again, please you can raise your hand there and I'll call you. And Dr. Tin Fei Sim will answer your questions. So any question from you? I bet there are many because it's a very interesting topic today because we don't have any, we are not qualified yet to become an immunizer here in Australia. And I remember I had that first aid training in Australia. I took that training because I think that's one of the requirements to get into the immunization course, I think, besides the first aid training. But because I'm a pharmacist overseas, I couldn't go to the course for the Australian pharmacists, but I get into the first aid training at the, I remember I did that at the police station in Claremont, and it was amazing. It was, we were using a mannequin to, to use also to put the defibrillator and everything. And how hard is it to press on the chest? Well, someone might have an anaphylactic or something. So it's, yes, I think it's a very, advanced technique for a pharmacist. And it's quite different with pharmacists in Indonesia because none of us has been given training or another course about immunization yet. So it's very interesting. And anyone will ask Dr. Tin Fei Sim about how they would give immunization in Australia? Nur Rahim, maybe? So are those students given the course of the immunization there? Are they in their last semester? Is it on the semester 8 or in their 4th year?
Yeah, in the last year. Yeah,
in the last year. Are there any requirements from the students as well? Oh, there are many questions.
Yes.
Okay, we'll start with Ophira and then Teresinha, Asifa, and then Mariam. Okay, Ophira, please.
Okay, thank you, ma'am. Good afternoon, Dr. Fei Sim. It's nice to see you again. I have one question for today. As already said that the pharmacist immunizer must complete a training course that compiles with the Australian Pharmacy Council standards for the accreditation, right? And I already looked up in the internet and I found a website. It says that the pharmacist immunizer must hold a CPR certificate issued within the last 12 months. And if the pharmacist is administering the vaccines to people who age less than 14 years of age, the pharmacist should have the CPR certificate for pediatric CPR training. And what is the what is it? Apa sih? Bu Vinci, hubungannya itu apa sih? What is the correlation? Sorry. What is the correlation between the CPR certificate and the vaccine immunizer, the pharmacist immunizer? Thank you.
Yeah, that's a really good question, Afira. So when you remember, when I did my presentation, I mentioned that because sometimes things can go wrong when you give someone a vaccine. If they have anaphylactic reactions, it can be fatal. People can die from it, which is why we're so particular about things like that. So as part of the requirement, all vaccinators, you must always maintain a valid first aid and CPR certificate, and also the SCARE anaphylaxis training certificate. So first aid is what Vinci, your lecturer, mentioned earlier. So to do the full senior first aid or even basic first aid, it usually takes about, you do some pre-learning online now, and then it takes about a day. But now with COVID, they try and do that in half a day. So part of that first aid course, you already learn about CPR. So CPR stands for cardiopulmonary resuscitation. So what that means is when someone, if you've seen in the movies, when someone has collapsed, they're not breathing. How do you try to make their heart pump again? Is you lay the person down, you press down on their chest. And CPR or cardiopulmonary resuscitation, now we recommend 30 compression. So you press 30 times on their chest to try to activate their heart. And the rhythm represents the rhythm of your heart rate, right? So you go like that. So 30 compression, 30 presses, and then you stop and you give 2 breaths into the person's mouth. But because of COVID now, they said if you don't feel comfortable breathing into the person's mouth, you don't have to breathe. You can just continuously do compression. So that's what we mean by CPR, cardiopulmonary resuscitation. When you do a physical first aid training in Australia, you learn about CPR as part of the training. So first aid certificate only valids for 3 years. So every 3 years, we must redo a full first aid. But the CPR component of the first aid is only valid for 12 months. So what this means is if I'm an immunizer, every 3 years I have to do a first aid training. Every 1 year I have to do a CPR training. But the year that I do my first aid, I don't have to do CPR because it's part of that anyway. So if this year, 2022, I do first aid, I don't need to do CPR because it's part of the first aid. Then 2023, I just do CPR. 2024, I just do CPR. Then 2025, I have to redo my first aid. And on top of that, I have to do the anaphylaxis training as well, which is online. And it's online to teach us how to recognize when people are experiencing anaphylactic reactions and how to give them adrenaline injections. So Vinci, do you have adrenaline injections in Indonesia?
No, in community pharmacy, we don't have any adrenaline injection because it's a prescription, but we do have it only in the hospitals here. So whenever there's anaphylactic or allergic reactions that need adrenaline injections, so they must go to the hospital straight away. So they're not allowed any adrenaline injections, only as prescription. So we don't have any adrenaline.
Right. Yeah. So in Australia, it's available it's available as a pharmacist-only medicine. You can't buy it from the supermarket. You have to have a pharmacist involved, but it's life-saving. So, and pharmacists are trained to give it to people.
Yeah. So we don't have any EpiPen and those type of things here in Australia. No rat test.
Yeah, it's EpiPen.
Yeah. No EpiPen, no rat test in community pharmacy. So yeah.
Yeah.
Does that answer your question, Afira?
Yes. So does it mean the main emergency side effect of vaccination is related to cardio system? Because why CPR? So is it related to cardio?
So it's cardio and other systems as well. So you might recall in one of the earlier slides, I talked about there are two diagnoses that will help you think if the person has anaphylactic reaction. So it's not just the heart, but it also attacks the breathing. So imagine that it attacks your respiratory symptom, your respiratory tract, your cardiovascular systems, and also your gastrointestinal systems as well, with or without skin rashes. That's not the skin rashes is not the thing that is dangerous for them. It's the attack on the respiratory tract. Imagine the breathing tract is in a spasm and it's swollen. They cannot breathe. And it affects, it has cardiovascular symptoms as well, and also gastrointestinal symptoms. Why CPR? Is because when someone has anaphylactic reactions, often they will very quickly go into unconsciousness and their heart can stop. And in order to keep someone alive, we know that their heart must continue to pump. That is why, you give someone CPR, because if they're not breathing, the heart has stopped, then you want to, CPR is the first aid that will be there to help save that person's life. But a defibrillator, which is the machine that sends electrical shock into the heart, that is the very effective treatment. That is the more effective treatment, I should say. So that's why often what happens is the first aider will immediately start CPR, but if I am doing CPR, I will immediately tell one of my team member, could you please go and get the defibrillator? The minute the defibrillator arrives, it should be used immediately.
So Opira, you know what is defibrillator looks like, right? In the movie that Dr. Tin Peshim talked about us earlier. So
yes, it's like the machine that shocks. Is it right?
Yeah, and then you put a pad with it has a sticky thing on one side here, then another side on the bottom, because you want to cross the heart, because the heart is here, right? So one on top, one on the bottom. So it sends the signal, so it goes through the heart.
Oh, I see.
Yeah, and you will see next time when you go to shopping centers in Indonesia, I'm sure it's in your shopping center, certain levels of shopping center where they have first aid and fire extinguisher for fire, often they have a defibrillator in a box.
Okay.
So we don't have any defibrillator in shopping center in Indonesia.
No?
Yeah, it's quite shocking. So they're only in the certain community pharmacy, but which we will have to order it beforehand. So it needs, ordering it before. So it's not an OTC thing to buy it here. That's why it's quite shocking not to have defibrillator here in the shopping center. We do have some fire extinguisher, but no defibrillator available in the shopping center. So that's good to know that it's actually free in shopping center in Australia. Just know it. Okay. Second questions. This should be Teresinha Clara, and then Asifa, and then Mariam. Teresinha, can you unmute yourself?
Yeah, thank you, Bu Vinci and Dr. Inzip. I have a question, Dr. Fatim. My question is the Pfizer or BioNTech vaccine. We also know that it as a commissary has been shown to prevent SARS-CoV-19 infection and death. My question is, does the Oxford University or AstraZeneca vaccine do the same?
I couldn't hear the first part, Vinci.
So can you repeat that again, Teresina? I think your voice is clear.
Okay. My question, no, the Pfizer or BioNTech vaccine, also known as a commissary, has been shown to prevent the COVID-19 infection, and as we know. My question is, does the Oxford University or AstraZeneca vaccine do the same?
Okay, so can I clarify your question again? So you're asking about Pfizer vaccination, and then what your question is, does the AstraZeneca vaccine provide the same effectivity as those Pfizer vaccinations? Is that your question, Teresinha?
Yeah, I can answer that. So so they're actually different vaccines. Yeah. So
yes.
The Pfizer vaccine, so Pfizer is the name of the company, right? The manufacturer, but the name of their vaccine is actually called Comirnaty. So the Pfizer Comirnaty vaccine and the Moderna vaccine, for example, these are two examples of what we call mRNA vaccines. So they're vaccines that use new technology or the mRNA technology. They are shown to be slightly more effective against certain strains, but the AstraZeneca vaccine is actually not an mRNA vaccine. It's actually a vaccine that uses the more traditional or conventional way of manufacturing. But when you're asking me about the effectiveness, they're all considered by, in Australia, we have TGA, which is the Therapeutic Goods Administration. So the TGA has approved all of those vaccines for use. But we also have what we call a ATAGI, which is Australian Technical Advisory Group on Immunisation, which are this group of experts on immunisation getting together to give advice around vaccines. And they've said that all of these vaccines are effective, but the latest one that only just arrived in the pharmacy 3 weeks ago, is the Moderna vaccine, but the new version of Moderna. Because we've been giving Moderna for a long time, for about a year already. The one that just came 3-4 weeks ago, it's the new version of the Moderna. It's the bivalent. We call them bivalent Moderna. Bivalent means that it can actually be effective against the zero, so the original strain of COVID-19 and the Omicron strain. So specifically the BA.1.2, and it has also shown to give some benefits and effectiveness on BA.4 and 5 variants as well. So that's the latest one that the ATAGI has recommended for people to use as a booster. So most people would have had their primary doses now. So primary doses meaning the first and the second. Most people have had their third, but not many people have had their fourth. So if they've had their primary doses, they can actually choose to get the bivalent Moderna vaccine now as a booster, as their third or the fourth dose. So that's available now in Australia.
Yeah. Does that answer your question, Teresinha? Oh, I see. Yes. So Moderna is now available in Australia as
bivalent.
Bivalent as a booster. Oh, I see. So currently in Indonesia, we only have until primary and until the third vaccination. We haven't had any fourth vaccination yet.
So we're doing the fourth one now because there is another wave of COVID right now coming. Yeah.
Excellent. Okay. Next question will be from Asifa. Asifa, can you please unmute? Yes.
Yes. Thank you, Bu Vinci. And
can you speak louder, Asifa?
Wait. Is my
yes?
Okay.
Perfect.
Thank you, Bu Vinci, and good afternoon, Miss Faye. I want to ask about one question, and so here my question. In Indonesia, in case of COVID-19 vaccine, there are some people that anti-vaccine, and the number is quite a lot, and they refuse to receive vaccine because of some reason, such as they are afraid of adverse event that caused by vaccine itself. So I want to know, is there a similar case in Australia, and how pharmacists in there handle it?
Very good question, Asifa. I think there are always people who would have different views, right, with everything. So I think the scenario that you explained in Indonesia definitely has occurred in Australia as well, which is why you're not going to get 100% vaccination rates, right? So the way how pharmacists will handle this is that as part of the vaccination training, pharmacists actually learn about what we call myths and realities. So pharmacists actually learn about the science and the facts about the safety of vaccines. So if someone comes, and pharmacists learn all about how to handle that in Australia. So if someone comes in and say, I don't want to get vaccinated, the first thing the pharmacist should do is to have a conversation with the patient to try and understand why. Why is it that they don't want to get vaccinated? If they are concerned about side effects, then you talk to them about what sort of side effects can they expect, what are the probability of them getting the side effects. If that happens, how could they manage the side effects? And also ask them more questions to find out about their histories and their background to see if you can give further advice around whether it is likely or not that they're going to get the side effects. So side effects are usually something you can talk to them about, and then give them facts and information. And often we can refer patients back with information. And in Australia, there is a lot of information on the Immunise Australia website, which you can go and have a look, and also on the Australian immunisation website as well, that we can refer patients to go and learn more about them. If someone says, I don't want to get vaccinated because every time when I get the influenza vaccine, I get the flu. Okay, if I use that as an example, right? Because you have flu vaccines, right, in Indonesia?
Yes.
Yeah. So a lot of people would say, I don't want to get the flu vaccine, or I don't want to get COVID vaccine, because every time when I get flu vaccine or COVID vaccine, I get ill. I feel unwell. I get the flu. The vaccine gives me the flu, right? They think because after vaccination, they get a fever, they get really tired, they feel like they have cold and flu symptoms. And they say, I was fine. I was healthy. You give me the flu vaccine. Now I've got the flu. And what pharmacists are trained to talk to them is to tell them the science, to tell them the facts. It is not possible to get the flu from a flu vaccine. It's simply not scientifically possible, because all flu vaccines are inactivated vaccines, which means they do not contain live viruses. It cannot possibly give you the flu. They are inactivated and or attenuated, which means weakened. And the reason, so we explained to them the reason why you felt unwell, you had fever, you had cold and flu symptoms, body aches, you feel so tired after having the vaccine, it's a normal response from your body generating an immune response. Because vaccines work by stimulating your body to generate an immune response. Vaccine in itself doesn't immediately give you the immunity. If you give me the vaccine today, if you give me a flu vaccine today, if tomorrow I go and get in contact with someone with the flu, I can still catch the flu, because it takes 7 to 14 days for my body to build an immune response towards the vaccine. So the time when my body is building an immune response, my body goes, oh, there is this virus, it's not real virus, not live virus, it's part of a virus. It looks like a virus, but it's not enough to give me the flu. But my body would go, oh, it looks like the flu virus. I want to build immunity to fight against it. When your body is trying to build immunity as part of your immune system, which I think you would have learned in your human biology, what do? You get temperature, you get high temperature, you get fever, because the thermostat, the thermoregulator in your brain, in particular in the hypothalamus in your brain, will reset that thermostat, because that's how your body temperature will go up. You might feel tired and body aches and cold and flu-like symptoms, because again, it's part of your body's normal immune response towards it. But also I would tell them, if someone says, no, I actually got vaccinated today, and then literally tomorrow I got the flu because I was hospitalized. They did a blood test. They said I had the flu. then I would tell them, well, because it takes 7 to 14 days for the vaccine to work, you might still be exposed to the virus, real virus from the environment after being vaccinated before your body has had an opportunity to develop an immune response. So the fact that you had a flu after the vaccine doesn't always mean it doesn't mean it comes from the vaccine. But also another thing I tell them is vaccines, like flu vaccines, they're different strains, right? You have different strains of viruses. Often in flu vaccines, you only have 4 to 5 strains. If someone travels, if they visit someone has been somewhere else, and they're exposed to a strain of virus that are not covered in that vaccine, they're at risk of getting the virus. So if they catch again the disease, it doesn't mean it will always come. It doesn't mean it has come from the vaccine. Is what I'm saying. So to answer your question, for people who have a lot of concerns about, I don't want to get vaccinated because I get all these problems and this and that, then we tell them the facts. And you would also see that there've been a number of years ago, there were some reports claiming that vaccines give people autism. And that has been proven to be not true. That is not true at all. There's no evidence that that is the case. So how can we help someone understand? We can refer them to proper websites, proper information. And in the pharmacy, I know some pharmacists will print out information already in their pharmacy and give it out as handout for people to read. And you can tell them, you can have a read, think about it, come back with questions tomorrow, the day after, we can continue that conversation with them.
So does that answer your question, Asifa?
Yes, of course. Thank you for the great answer, Miss Faye.
So it's quite challenging to convince someone to change their mind, right, Faye? Okay, next we're moving to Mariam. Can you unmute yourself, Mariam?
Can you hear me?
Yes.
Okay. Thank you for the time, and it's really nice to see you again. Maybe I have several questions. The first one is
Sorry, Mariam, speak louder. I think the background of your is quite a bit noisy, your background. So
yeah,
if you can speak louder, it will be good.
Okay. Why do you? The first question is, why do you have to record patient consent to take vaccination? Because if someone wants to make appointment or walks into pharmacy to ask for vaccine, isn't that they already consent to do that? Why do you have to still record their consent? And I guess it's gonna make the process a bit more complicated, in my opinion. And the thing is, patient consent is a new thing for me. I never heard that before. Maybe in Indonesia, I haven't heard of similar things like that. And why vaccination have to take patient consent? If you buy drugs, you don't have to make consent about it. Maybe that's my question.
Yeah, that's a good question, Mariam. So when someone comes in and buy a medicine from us, we sell them the medicine. We are not administering the medicine. It's still up to them if they want to take it or not, right? But if you are injecting someone onto someone's arm, you want to make sure that they know what they're getting. They're not going to come back and sue you because they don't understand enough. So I see your point about when someone either walks in or asks for it, it means they already want it. Why do we still want consent? So go back to the 3 elements of consent. Remember, a valid informed consent, legally, it means that it's not just them saying, yeah, I'll have it. You have to make sure that they understand the procedure, what they're getting. They have to make sure that they are legally and capable to actually make consent. Because if someone might come in and say, I want to get vaccinated, but they don't know what they're getting, and then something goes wrong, they come back and they would sue you and say, well, you didn't tell me. I said I want to get vaccinated, but you didn't ask me. You didn't tell me that this interacts with my other vaccine. Or you didn't ask me about my previous history or whatever. So it has informed valid consent means that you have to consider all 3 of those elements. But also there are a lot of circumstances where when someone makes an appointment online, these days, because pharmacists do so many vaccinations, because we want to make it efficient, when someone makes an appointment online, sometimes you can build into the system, you can already ask those questions on the system. So that's part of your screening process. And then you can build in there by clicking these, or by clicking to the next page, you agree to provide consent to be received. So you would still, that is still consent, whether it's online or they sign in front of you. So you still need consent.
So does that answer your question, Maria?
Also, like it's like solidify the reason to take vaccination, to make sure that they really want to take the vaccination. Okay, maybe thank you for that. Well, my second question is, you mentioned that like if the pharmacist already perform a good hand washing, good hand washing procedures, they don't have to use gloves to administer the vaccine. But why is that? Why pharmacists don't have to use gloves? I guess like, isn't it makes it more more safer, more cleaner to use gloves rather than just using your bare hands to administer some injection to someone else?
Yeah, a good question. Well, gloves are not necessarily cleaner, because what you see is when people wear gloves, they don't change their gloves. They go patient after patient after patient, and then they handle money at the till, and then they come back and give vaccine because they think they're wearing gloves. So gloves are not always clean, right? So if you see people wearing gloves in supermarket, it's not always clean, because they take money, then they give you food wearing gloves. It's not, gloves are not always clean, right? Unless you change them. But also, if you practice good hygiene, good hand hygiene, like you follow the steps and you do hand hygiene in between patients, so you're not spreading across, you're reducing cross contamination. And if you don't have any cuts or wounds on the hands, there's no need to wear gloves. And also sometimes it has been reported as well that if there's no need to wear gloves, when you use aseptic technique. So aseptic technique means sterile technique, right? Means you use a technique such that you prevent all kinds of contamination. If you use aseptic technique correctly and you practice good hand hygiene, there is no need to wear gloves, but you insist on wearing gloves, it sometimes might actually give patients, it might become a barrier to patients, because there might be that perception to patients who might already be hesitant to receive vaccine and go, what are you giving me? If you think it's so dangerous that you even have to wear gloves when you handle, why are you giving, it's coming into my body. So it does, psychologically also, it has been reported that it can create another barrier, another clinical barrier, another perception barrier for people. But obviously, in clinical practice, if the clinical need of wearing gloves outweigh any barrier, then of course you wear them, such as performing a surgery by doctors, such as a pharmacist changing wound dressings, because in Australia, pharmacists change wound dressing as well. If someone had fallen over outside, they come in bleeding, pharmacists will do first aid and dress them up. 100% wear gloves. Why? Because broken skin, blood involved, you could have increased risk of bloodborne viruses, contamination, and so on. Absolutely, then you wear gloves. But vaccination and injection, if you use aseptic technique, and they might bleed. Actually, I forgot to mention that sometimes people bleed. You might have bleeding after vaccination, and bleeding doesn't always mean it's bad technique, because our eyes can't see where the blood vessels are. If you accident, and especially if it's intramuscular injection, chances are you might hit some blood vessels, and we're humans. If you hit blood vessels, they're going to bleed. But it's knowing how to handle that and manage that later to prevent contamination and contamination. That's the most important. So to come back to your question, if you follow protocol and procedure, there's no need for you to wear gloves. But if you have cuts and wounds on your hands, then yes, you would have to evaluate on a case-by-case basis. Well, that's the current recommendation, but the recommendation can change. As we know, in COVID, things change every month, so it might change.
Also, it's new information, like using gloves always and administering some injection to person. Maybe my last question is, it's related a bit related to my previous question last week. Does it mandatory for pharmacists to qualify as immunizer pharmacists? Because like I guess it's gonna be quite challenging for someone who's like a foreign pharmacist, maybe someone like me who wants to work as a pharmacist in Australia and we don't have anything such as immunizer qualification, something like that. Is it mandatory or?
Yeah. So right now, Mariam, right now at the moment, it is not mandatory. So not all Australian practicing pharmacists are immunizer. The majority of them are, but it's not compulsory. But because vaccination is quite new, in the last few years, many universities in Australia have already started to integrate formal vaccination training within the pharmacy course. And in some courses, they may make it mandatory for students to attend the training, but not necessarily you have to have the qualification. Because like I mentioned earlier, injection is only one of the many steps. If a pharmacist don't feel comfortable right now injecting, they can still participate at the start and the finish. They can still help with patient screening, patient counseling, patient monitoring after vaccine has been given, helping to direct clerical work or clinic flow, call people, make them to come into the clinic, monitor them, give them counseling, tell them how to manage side effects. Pharmacists can also do documentation, record vaccination encounters onto the Australian Immunisation Register. So there are all these things that pharmacists will need to know. And also, if you work as a team in a pharmacy, Mariam, I might be the vaccinator to inject. You might not be the immunizer. But if something happens, touch wood, and there's an anaphylactic reaction, I can't do everything. I would say, Mariam, I'm going to start first aid CPR. Can you please go and get the defibrillator? Can you please call the ambulance? Can you please, do this and that? So you still need to learn about them to be able to play in a team. So the sticking the needle into someone's arm, that might be the part I understand some people might or might not feel comfortable doing. Right now, it's not mandatory for pharmacists to do that, but more and more pharmacists are being trained to do that.
Okay, thanks a lot for the answer. That's maybe on it. Thank you.
So that's answer your questions. Okay, any questions again? So as you all know, you can email your question again to me, and I will direct it to Dr. Tin Pei Sim. If you still have any questions, any queries, any clarifications, you can ask me and I can direct it to Dr. Tin Pei Sim. Before closing, just a quick question. How do you, this is just for the knowledge for the students as well. How do you teach pharmacy students how to do immunization at the university? Do you provide any any mannequin that you do for the immunization or something like that? I'm a bit curious. How do you students? Yeah.
Well, Vinci, while you were in Australia, I should have invited you to one of the workshops for you to see how it's all done. We actually at Curtin Pharmacy, we actually license training materials from the Pharmaceutical Society of Australia, but we run the workshop trainings in-house ourselves. So I run the training myself at the pharmacy school. So students have to do about 10 to 12 hours of online pre-learning to learn about the theory. Then they come for a 1 day, 8 hours face-to-face practical. So we have mannequins. We also have intramuscular injection training pads, so fake arms, and they practice a lot on the fake arms. But the final practical assessment, if they want the qualification, they have to administer saline injection, intramuscular and subcutaneous onto each other's arm.
Each other arms to the other student.
Yes, because your first injection should not be on a real patient, right? It feels a little different. And it's not just the physical technique, it's also you should be going through the whole emotional aspect of it as well. So you know how to care for your patient. Can you imagine if you sit in front of your patient and your patient find out this is the first ever injection. Can you imagine? Can you imagine if you are that patient and your pharmacist or your doctor is giving you injection for the very first time? They've never done it before. It's not fair to patient, right? It's not fair to you as a patient. So it's something that has to be done very safely. And pharmacists have proven, not just in Australia, but worldwide, that we can do it very safely and effectively and very productively. So we can do it. So that's why we stress so much in the training to do it properly. Yeah. So and every step is guided and monitored.
Does it mean do they need also a consent between students when they're doing that saline injection?
Yeah, they sign a waiver, they sign a consent, absolutely. And it's their choice. They don't have to do it if they don't want to. It's completely their choice. Yeah.
Oh, interesting. So students, you know now how in Australia university teach pharmacy students and becoming a qualified immunizer. So later, if you want to continue your your degree, or you're going to master's degree or PhD degree, you can either contact Dr. Tin Pei Sim again, like me, to become your supervisor. So she's more than qualified to become your supervisor, supervising you in all of your research project, especially in minor ailments or immunization and everything, pharmacy practice and everything. So thank you very much for today's sessions, Faye. I would like to say thank you to Dr. Tin Pei Sim on behalf of the Department of Pharmacy, 11 Maret University, Surakarta, Indonesia. Thank you very much. It's a pleasure to have you here, Faye. There's so many knowledge that you could share with the students here. I think they know now how to become a good pharmacist later on. And I think they would want to become, some of them, I think I can see from their eyes, they want to become qualified immunizers as well. So I think they're curious. So it's a very, very enlightened knowledge and skills that you shared today, Faye. And I also like to say special thanks to Mas Anton Sudarwan. So Mas Anton here is the administration of the Department of Pharmacy here, Faye, who likes to help us to organize and to put this lecture into YouTube on live and everything. So thank you, Mas Anton. Thank you very much, everyone. Thank you very much, Faye. We hope to have you again, maybe for the other next session, or maybe we can invite you again to come to our country. Once COVID is done, or once it's safe for you to travel, we would love to invite you to come to our country to have another talk and to have another discussions again. Well, thank you very much to Dr. Tin Pei Sim again. And thank you very much, everyone. I hope you all enjoy your evening. Have a very nice evening. Have a very nice evening to you too, Faye. Thank you all. And I will end these sessions today for the International Guest Lecture 2022 with Dr. Tin Pei Sim. Thank you very much. Bye-bye.
Thank you. Bye.
Bye.